Good day! I am Hershey's Katrina Arnoka, a second-year nursing student, and today we will be learning first aid. The first one that I'm going to explain and demonstrate is the CPR, or the cardiopulmonary resuscitation. First is, what is CPR? CPR is a life-saving technique which aims to keep blood and oxygen flowing through the body when a person's heart and breathing stop. It is a combination of chest compressions and rescue breaths or mouth-to-mouth resuscitation. When to do a CPR? It should only be performed when a person shows no signs of life or when they are unconscious, unresponsive, not breathing, or not breathing normally. Number 1. Survey the scene. Make sure it is safe for you and the person in need of help. Consider the reason why the person appears to be in trouble. Is there a gas present or have they been electrocuted? Might they be drunk or drug affected and consequently a hazard to you? Approach with care and do not put yourself in danger. If the person is in a hazardous area such as on a road or side of the road, it is okay to move them as gently as possible to protect both you and your safety. So check if there are any falling debris, and if you are in a hazardous area, as I said, move the patient away from the hazardous area. Step 2. Check for a response. Try to shake or tap their shoulder lightly or talk to them. Ma'am, sir, can you hear me? If there's still no response, we will proceed to step 3. Call for help. Ask someone else to call 911 or get some help. So now we will do the CAB. Compressions, airway, and breathing. So step 4 is compression. Compression restores blood flow. Compressions means you'll use your hands to push down hard and fast in a specific way on the person's chest. And there are different ways on how to do chest compressions, depending on the patient or the person in need of help. In adult, it uses both hands, interlocked, then between the nipples, pressing 2 inches down. In children's 1 to 8 years old, use one hand between the nipples, pressing 2 inches down. In infants, use 2 fingers at the center, just below the nipple line, pressing 1.5 inches down. So first is in the adult. Again, interlock the fingers and push downward, 2 inches downward, and don't bend your elbows. 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Next is in a child. So again, when performing chest compression on the children 1 to 8 years old, only use one hand and use this part of your hand between the nipples. Then 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Next is in an infant. So again, when performing chest compressions on an infant, only use 2 fingers and just below the nipple line, pressing 1.5 inches downwards. So perform 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So, next is step 5. Step 5. Perform 2 rescue breaths. Lift chin slightly to open airway. For infants and children from age 1 to 8, a head tilt alone will often open their airway. Pinch their nostrils shut and then give 2 rescue breaths lasting for 1 second each and 1 second apart. Tilt the head, pinch the nose, and then 2 rescue breaths. Next is on an adult. Tilt their head, pinch the nostrils shut, and then give 2 rescue breaths. Step 6. Alternate rescue breathing with chest compression. Alteration of 30 compressions with 2 rescue breaths until the paramedic or the ambulance arrives. If the person begins to breathe, have him or her lie on their side quietly until medical assistance is on the scene. Then, step 7. Reassess the victim after 5 cycles. If they are conscious, breathing, or have an airway and restored circulation. Care of the victim after a successful CPR. First is transfer in a secured place. Then, place in a side-lying position or the recovery position. Then, bend the knees like this. Then, wait for the medical response and continuously monitor the victim. The next first aid is when someone is choking. So, choking occurs when a piece of food, an object, or a liquid blocks the throat. Children often choke as a result of placing foreign objects into their mouths. Adults can choke from breathing in fumes or eating or drinking too rapidly. A person who's choking may cough continuously until they expel the food or liquid from their throat or airway. However, in some cases, the object, food, or liquid gets stuck in the throat as of the air supply. A person who's choking may display an inability to speak, cough, make noise, and breathe. So, what are the causes of choking? Common objects that children choke on are popcorn, candy, pencil erase, small toys such as Legos, and carrots, hot dogs, chewing gum, peanuts, cherry, tomatoes, whole grapes, and large pieces of fruits, and also large pieces of vegetables. So how can we know that someone is choking? So the universal sign for choking is hands clutched to the throat, like this, or like in the picture. So if the person doesn't give the signal, look for these indications: inability to talk, difficulty breathing or noisy breathing, squeaky sounds when trying to breathe, cough which may be either weak or forceful, skin, lips, and nails turning blue or dusky, skin that is flushed, then turns pale or bluish in color, and loss of consciousness. Heimlich maneuver is a first aid for choking. So these are the steps to perform the Heimlich maneuver. So this is the picture. So step 1 is stand behind the person with your arms wrapped around their waist. Lean the person forward and then ball your hand into fist and place it on the person's abdomen above their navel. And then use your free hand to grip your first fist and press into the person's abdomen, in and upward. In and upward. Repeat that 5 times. 4, 5. So if the object is still stuck in the person's throat, repeat these steps 5 more times. So 1, 2, 3, 4, 5. So, to clear the airway of a pregnant woman or obese person, so this is the picture. So, position your hands a little bit higher than with a normal Heimlich maneuver, at the base of their breastbone, much higher, and just above the joining of the lowest rib. Then, proceed as the Heimlich maneuver, pressing hard into the chest with a quick thrust. So, repeat this until the food or other blockage is dislodged. Again, in, up. 2, 3, 4, 5, 6, 5 more if there is still a blockage. 7, 8, 9, So to clear the airway of a choking infant, first is assume a seated position and hold the infant face down on your forearm which is resting on your thigh. Support the infant's head and neck with your hand like this and place the head lower than the trunk. And then thump the infant gently but firmly 5 times on the middle of the back using the heel of your hand. The combination of gravity and back blows should release the blocking object. Keep your fingers pointed up to avoid hitting the infant in the back of the head. So, 1, 2, 3, 4, 5. So, turn the infant face up on your forearm, resting on your thigh with the head lower than the trunk if the infant still is not breathing. Using 2 fingers, place at the center of the infant's breastbone. Give 5 quick chest compressions. Press down about 1.5 inches and let the chest rise again in between each compression. 1, 2, 3, 4, 5. Repeat the back blows and chest thrust if breathing does not resume. Call for emergency medical help. Begin infant CPR if one of these techniques open the airways but the infant does not resume breathing. Next is first aid on bleeding or open wounds. Before you begin to treat an injury, you should identify its severity as best as you can. There are some situations in which you should not try to administer any kind of first aid at all. If you suspect that there's internal bleeding or if there's an embedded object surrounding the site of the injury, immediately call 911 or your local emergency services. First aid do's and don'ts. First aid do's. Help the person to remain calm if the cut is large or bleeding heavily. Have them lie down if the person's wound is on an arm or leg. Raise the limb above the heart to slow bleeding. Remove obvious debris from the wound such as sticks or grass. If the cut is swollen, wash it out with soap and water. After putting on clean latex gloves, apply firm pressure to the wound with the folded cloth or bandage for about 10 minutes. If blood soaks through, add another cloth or bandage and continue putting pressure on the cut for an additional 10 minutes. When bleeding has stopped, tape a clean bandage over the cut. Then, first aid don'ts. Do not remove an object if it is embedded in the body, and do not attempt to clean a large wound. When first applying the bandage, do not remove it to look at the wound during this time. It may begin bleeding again. If a person is bleeding profusely, be on the lookout for symptoms of shock such as cold, clammy skin, a weakened pulse, and loss of consciousness. It can all indicate that the person is about to go in shock from. Now, first aid for wounds with severe bleeding. First is inspect for foreign object lodged in the wound area. It can be removed manually by hand or using pickup forceps. So there's no any objects. Then control bleeding. It is done by applying sterile absorbent gauze pad over the bleeding site while applying a firm pressure. Dressing can be secured with a bandage and splint. Then, continuous assessment and observation for shock. So, signs and symptoms include pale cyanotic, cold and clammy skin, irregular breathing, weak or rapid pulse, weakness, thirsty sensation. And then, when your skin is cut or scraped, you begin to bleed. This is because blood vessels in the area are damaged. Bleeding serves a use purpose because it helps to clean out a wound. However, too much bleeding can cause your body to go into shock. So now, refer to a physician. It is essential in severe bleeding wounds. Then, for further medical or surgical management may be needed like suturing or administration of medication. First aid for wounds with mild to moderate bleeding. First is clean with mild soap and water. Then, disinfect using topical antiseptics such as povidone iodine or topical antibacterials. Then, dress the wound. Apply sterile gauze pad with dressing. Then, secure it with adhesive tapes. A first aid kit that's properly stocked can make all the difference in stopping heavy bleeding. You should keep the following items around for situations where you may need to close a wound: sterilized medical gloves, sterile gauze dressings, small scissors, and medical grade tape. Bloody nose or a nosebleed. A bloody nose is common in both children and adults. Most nosebleeds are not serious, especially in children. Yet, adults can have nosebleeds related to high blood pressure or hardening of the arteries, and it may be more difficult to stop them. Have the person sit down and lean their head forward. This will reduce the pressure in the nasal veins and slow the bleeding. It will also keep blood from flowing down into the stomach, which can cause nausea. If you'd like, use a nasal the bleeding nostril while the person holds their head still. Have them push the bleeding nostril firmly against the septum or the dividing wall in the nose. If the person is unable to do this, put on latex glove and hold the nose for them for 5 to 10 minutes. Once the nose stops bleeding, instruct the person not to blow their nose for several days. This could dislodge the clot and cause bleeding to begin again. So the last topic for first aids is burns. The skin has an important role to play in the fluid and temperature regulation of our body. If enough skin area is injured, the ability to maintain that control can be lost. The skin also acts as a protective barrier against the bacteria and viruses that inhabit the world outside our body. Burns are one of the most common household injuries, especially among children. The term burn means more than the burning sensation associated with this injury. Burns are characterized by severe skin damage that causes the affected skin cells to die. Warning: unpleasant photo ahead. So these are the types of burns: first degree burns, second degree burns, and third degree burns. A first degree burn is superficial and causes local inflammation of the skin. Sunburns often are characterized as first degree burns. The inflammation is characterized by pain, redness, and a mild amount of swelling. The skin may be very tender to touch. Second degree burns are deeper and, in addition to the pain, redness, and inflammation, blistering of the skin also occurs. Lastly, third degree burns are deeper still, involving all layers of the skin, in effect killing that area of the skin because the nerves and blood vessels are damaged. Third degree burns appear white and leathery and tend to be relatively painless. The symptoms of third degree burns can exhibit waxy and white color and dark brown color. So what is the importance of the location of the burn? Burn location is an important consideration. If the burn involves the face, nose, mouth, or neck, there is a risk that there will be an inhalation injury and enough inflammation and swelling to obstruct the airway and cause breathing problems. First aid for minor burns. First degree burns or second degree burns involving a small area of the body. First, cool down the burn. After holding the burn under cool running water, apply cool, wet compress until the pain subsides. Though butter has been used as a home remedy, do not use it on any burn. Second, remove rings, bracelets, and other potentially constricting articles. Edema and or swelling from inflammation may occur and the item may cut into the skin. Third, avoid breaking blisters. Blisters with fluid protect the area from infection. If a blister breaks, clean the area and gently apply an antibiotic ointment. After the burned area has been cooled, apply a lotion or aloe vera to provide relief and keep the area from drying out. Fifth, the burn may be dressed with a topical antibiotic ointment like bacitracin or neosporin. 6. Loosely bandage the burn. Use sterile gauze. Avoid fluffy cotton that could shed and get stuck in the healing area. Avoid putting too much pressure in the burned skin. And lastly, if there is a concern that the burn is deeper and maybe second or third degree in nature, seek medical care. First aid for a major burn. The first step in treating a major burn is to call 911 or seek emergency medical care. These are the steps to take until emergency arrives. Include: make sure you and the person who's burned are safe and out of harm's way. Move them away from the source of the burn. If it is an electrical burn, turn off the power source before touching them. If there's a fire, move away from the fire as far as possible. Check to see if they're breathing. If needed, start rescue breathing if you've been trained before. But before performing CPR, check the chest first if there were burns, as burns of the chest may restrict expansion of the chest wall because of the stiffening of the dermis in deep burns, which can impact respirations. Fourth, remove restrictive items from their body, such as belts and jewelry in or near the burned areas. Burned areas typically swell quickly. Fifth, cover the burned area. Use a clean cloth or bandage that's moistened with cool, clean water. 6. Separate fingers and toes. If hands and feet are burned, separate the fingers and toes with dry and sterile non-adhesive bandages. 7th, remove clothing from burned areas, but do not try to remove clothing that is stuck to the skin. 8. Avoid immersing the person or burned body parts in water. Hypothermia or severe loss of body heat can occur if you immerse large severe burns in water. 9th, raise the burn area. If possible, elevate the burn area above their heart. And then, watch for shock. Signs and symptoms of shock includes shallow breathing, pale complexion, and faint. Things not to do. Do not contaminate the burn with potential germs by breathing or coughing on it. Do not apply any medical or home remedy, including ointment, butter, ice, spray, or cream. Do not give the burned person anything to ingest. Don't put a pillow under their head if you think they have an airway burn. Chemical burns. Burns caused by direct contact of chemical into skin. Warning: unpleasant photo ahead. So this is an example of a chemical burn. These are some examples of chemicals that causes burns: car battery solution, hydrochloric acid or muriatic acid, bleach, and ammonia. For chemical burns, immediately remove the chemical by flushing with water. Remove the victim's contaminated clothing. Use mild soap for the final rinse. Then, pat dry the area using clean cloth and apply dressing into the affected area. If the chemical is in the eye, flush for at least 20 minutes using low pressure. Lastly, seek medical attention immediately for chemical burns. You don't have to be a doctor to save lives. Learn first aid.